Following the tripartite Cotonou Agreement signed by the European Union and the African, Caribbean, and Pacific Group of States in the last 20 years, significant transformation in lives and communities have been impacted through the reduction and eventual eradication of poverty, while contributing to sustainable development through initiatives centered around health, water resources, solar energy, infrastructure development, education, and livelihood enhancement. In consonance with the agreement, over time, the European Union has embarked on transformative interventions to address the pressing healthcare needs of some communities. These efforts have encompassed aspects ranging from bolstering infrastructure and capacity building to leveraging technology solutions for medical supplies across some primary healthcare facilities in the country.
Since the commissioning of this facility, we've been battling with the problem of plumbing network and erosion.
During rainy season, our patient cannot have access to the facility. We cannot rush emergency to the facility.
Even somebody want to came this health facility in the midnight, he will be fearing, say road, light no day, the hospital maybe they don't have gene.
So in the past, routine immunization has been very, very, low. The coverage was low. The offtake due to so many reasons.
Challenge da aka ta fuskanta shi kansa vaccine din ba a samun ajiye ta nan wanda lokacin ba a gina gurin ba wanda in CCO ya tafi dauko vaccine zuwa Kano za ga cewa ya dau lokaci wanda ko facilities sun taru nan za a samu wani ma ya gaje ce zai tafi tunda ba ka ba.
When we didn't have the working cold rooms, we could hardly collect all our allocation of vaccines for the quarter.
And so when Plateau was operating, we were having difficulties. It was a big challenge for Plateau State to store vaccines, especially when it comes to campaigns. And it was also difficult for Plateau to distribute vaccines down to last mile. When I said last mile, I'm referring to the LGA and health facilities.
Over the last 2 decades, the EU-Nigeria Development Cooperation has been a tremendous journey. And this is part of a shared vision based on mutual respect and a joint commitment to sustainable development to improve the lives of Nigerians.
The various EU interventions have added tremendous value, caused positive change, and catalyzed action for upscaling desirable outcomes.
About 6 million people benefit from this cold store. This cold store serves about 6 million people, more than 6 million. And we are so grateful to European Union because without them, it would be very difficult to get a structure like this that would have served the state.
Before, if we work in the facility 1 to 2, we are tired, you know, because of the condition of the environment. But now, because of the solar panel, the paint, the renovation, we don't have issue of erosion within the facility. If we come to this facility, we work 24 hours in this facility.
The benefit we have is that the EU came here to renovate this facility. 2016. Since then, we have been working, benefiting. Many agencies are coming, and we are benefiting more.
Because this hospital is helping people around here, both strangers and the indigenous of this town.
Because without the building and the solar direct drive, we will not preserve our vaccine. So it's of great need to us. We thank the EU very well for providing such for us.
Amma dai wannan ginin da aka yi gaskiya ya taimaka ba wai dawaki ba har zuwan na Kumbotso gaba daya. Sai waɗansu LG ko yanzu ma wannan program ɗin da za yi Kumbotso a dawakin kudu ta yi kai wa Kumbotso local government waɗansu kayayyaki saboda ganin tana da shi is available.
Sannan daga wasu others area ɗin ma za ka ga sun zo su ma kuma sun tafi da wuri. Idan matsala ce da ke ko ta girki ko ta yara za su tafi makaranta dai za ki zo mu sallame ki da wuri, babu ruwanki da wani jira. Sannan kuma ba ruwanki da sai vaccine ta ƙare wani lokacin an tafi ƙara ɗaukowa. Gaskiya dai muna farin ciki da wannan.
The coastal Ikorodu coastal is operational. It serves the environment of Ikorodu and make it easier for the nurses, the immunization officers, and the community to benefit faster, easily, and more importantly, to make the vaccine potent.
The EU footprints in Nigeria are etched in our efforts for reforms in the justice sector, electoral governance, public financial management, water and sanitation, fight against anti-corruption, competitiveness, and quality infrastructure, energy, public health system, and civil society governance.
In fact, we are very grateful. We are happy that we have this. It has really helped in vaccine delivery, in fact, overall, vaccine management has really improved.
EU side actually has been a catalyst, for changing the routine immunization space in Kano. And since that time, Kano has been going from strength to strength in the area of routine immunization. So I appreciate.
We are very grateful to you for bringing these projects as they come one after the other, EU strict, EU science, so on and so forth.
So we are very grateful to EU Prime, the European Union, for what they have done so far for us, and we are still expecting more.
I have my words of expression to EU Sign and EU Prime to the utmost level of what they can expect from me. Thank you.
You can go from the beginning, what it was before now. There were actually a lot of challenges that the community were faced with. Number one, the various waterborne diseases that were predominantly found in this area that can also be traced to the clinics that we have here.
Being on a high altitude, even if rain falls, the water goes immediately. And those that have wells, it easily dries because of the location of the topography of the state. So we had a lot of challenges of water supply.
We used to be fetching water in the streams. Our streams no more work
because of those people that have been dredging sand. All our streams have gone.
Because we tried to sink a lot of boreholes in this school. More than 20 boreholes have been sunk in this school, but 50% of it were abortive.
Kafin a kawo ruwan nan gaskiya mutane suna cikin matsalar ruwa domin ruwa rijiya ba ta yiwa a nan sai sun je can kogi kuma tsakanin nan da kogin da ya kai mil 4 zuwa 5. Ya gani? To saboda haka samun wannan ruwa ya zama babban ni'ima gare su.
Lokacin da ba kawo mana project nan ba lokacin muna shan ruwa da dabbobi a wuni daya. Ba tsabtace ruwa wanda zai ba mu ruwa.
Kuma dam da muke da shi guda ɗaya ne a Sibulakun gaba ɗaya kuma muna tare da yara kusan 100, 1,200, 300. To wannan lokacin ruwan ba iya isan su ma yi amfani da shi abin da kama daga safiya zuwa dare.
An essential for life is water. Providing potable and safe water is one of the key projects embarked upon by the European Union, especially as a result of deficit of clean and safe water in some states in the country. Some communities enjoy a complete startup, while in some communities, intervention came in form of an expanded water supply scheme.
This project was aimed for the purpose of producing water for domestic usage, for people to fetch, cook with it, drink with it, bath with it. So with this project now, there is a great improvement on the lives of the people in this community.
Over 10,000 people almost collect this water because the water was transferred for the whole 3 villages. In fact, we are very happy. This water project here have so much help us here because in the whole of Odo community, this is the only cleanest water we have.
And we in this community, we have benefited so much because it's a solar energy and well treated.
So this intervention has made us to go back to our status quo, to enjoy water from the university, from the riverside to the university.
The water has been so useful and helpful to us, and it's 100% beneficial to the student living in C block here. If you can see this water, other water are running off, but this water remains constant.
Initially, there is no complete water, more especially in Gela. So EU have now went to Gude, which is another village, and from there, they find a water and send it to people of Gela as well.
Gashi da mu da yaran mu da manyan mu kowa yana daga cikin farin ciki muna alfahari da ita kuma da ita muke iba muke wanka muke abinci muke wanki muna farin ciki muna kuma godiya Allah ya ƙara Allah ya ƙara ɗaukaka.
With the inception of this project, we can categorically appreciate EU that the issue of quality water has been taken care of because we now have treated water, and that now goes to having a lot of diseases that were related to the poor water that people were taking, now to an extent taken care of.
Wa tsafta sosai ma clean water ne sosai ruwan kowa ya sha ruwan ma yana yabawa ruwa mai haske ne mai kyau ba mu da ingantaccen ruwa kamar shi wallahi.
I want to please plead and beg that if they can come, European Union can come back again, visit us here to at least project more to stands. In addition to this present one, it will help us a long way.
We want them to extend it for us. We need it so that we may not be going about to go to the bush and draw water again.
The population keep growing. There is need to extend the services to adjoining communities and villages around so that at the end of the day, we will be able to provide 24/7 services.
The project has brought a lot of relief to people. We wish there are other communities that are undergoing this kind of difficulty in water supply. So if the EU can help us extend also to those communities and the life of the entire people in Plateau State will be improved.
Sometimes in 2014, there was a serious insurgency problem across the three northeastern states, particularly Borno, Adamawa, and Yobe. And actually, it has affected our state negatively, which culminated into loss of almost 8 northern local governments of the state to the insurgents. They occupied the place for almost a few months before repelling them back. As a result of the occupation, serious damages were inflicted on most of the facilities, particularly power, health facilities, educational facilities, road infrastructure, water, and most of the developments, properties, personal properties were seriously destroyed.
Committed to sustainable energy solutions, the European Union introduced solar power in hospitals, schools, even solar to power water boreholes. This initiative has transformed the lives of millions of people, from students, health workers, patients, and community members alike.
Lokacin da nake zuwa nan babu wuta ban taba jin daɗi ba, saboda idan dare yayi ba ma kallon hanya, ko da ma muna so mu fita ne waje babu wuta ne za mu kalla mu fita, kuma ya wurin yakan ba mu tsoro.
Most at times we have like accident cases, and then we use lanterns. You can't see what you are doing clearly, especially during suturing. And sometimes in the labor ward, when a woman delivers, for you to even see clearly what you are doing is really stressful.
During the night time, when we don't have light, we don't have solar, most of the students either forfeit reading till the following day or go out scavenging for a place that have light to read.
We used to spend a lot of money on buying fuel, servicing generators, and yet there is fluctuations of this light. It is not enough. It is not up to 1/4 of our needs. That's how we are struggling before this intervention.
Encouraging the use of solar energy, the European Union is likely contributing to an eco-friendly planet with the reduction of carbon emissions, pollutions, and fighting against global climate catastrophe.
By no means this has obviously helped to improve healthcare service delivery a lot. It has increased obviously a lot of accessibility to healthcare. More so, it has also contributed to the issue of pollution, so to say.
Since the invention of the solar, there is very much turnout of patients, and whatever we are doing, in fact, we are joyful doing it because there's light everywhere. Everywhere is very bright. And then for our patients, in fact, they are really enjoying the light because there's always a 24-hour light in the hospital.
And this light has touched the life of every person in this college, both students, staff, and whoever that is that has something to do with this college.
We have ICT system in this school. We benefit it. Number 2, we are going to reading at any time, at any moment. For the security purpose, we are going to any place we like for reading. And number 3, we are charging our phone with it, and it is helping for us. We can't say anything. This solar is helping us so much.
Since the inception of the school, we've never gotten any intervention that is up to the solar that we got from EU. This is the biggest intervention since, I think, 1976. After the building, we've never gotten anything like this.
Kafin EU su zo, gaskiya a month ba ma iya karɓar labor guda 20. Amma zuwan EU sun kawo mana solar safe da rana da yamma, gaskiya muna samu iya labor ma monthly muna samu 70-80.
So the EU actually came in at the right time when government was in dire need of support for revitalizing their health institutions, because these are the first thing that is mostly required in those areas. And thank God, we have about 8 health facilities that were actually provided with alternative power supply.
The success story I'm hearing from them is what is giving me joy and hope to say thank you to EU, because our people are benefiting from these installations.
Most of these communities that we never thought will go back to their ancestral homes are now back to their ancestral homes, picking up the pieces of their lives as a result of this massive contribution. The years of insurgency in Borno State is better imagined than the story being told. It hampered the development of Borno State for over a decade that the insurgency lasted, and we still have skirmishes, but to God be the glory. A lot of partners have supported the reconstruction, the rehabilitation, and resettlement of displaced communities.
So of course, to make sure that all of those 5,000 projects that we've been investing on remain, and its ownership is key, and the maintenance and the upscaling, and to ensure that this project continue to benefit over time those communities. Here we need both the communities themselves, but also the government at the federal level and also at state level, local level, to ensure that the resources are there to make sure that those projects don't go to waste.
Building a sustainability plan, infrastructure for continued education featured prominently in the EU projects.
Not only that, before the erection of this building, when there was rainfall, we send them back home. Or else we come together and sit in 2 or 3 rooms. If we send them by then home, problem. We keep them problem. There are great changes when the community, the learners, and the entire community saw this building. They brought very many new enrollment, right from nursery 1 to primary 6. So learning improves, enrollment improves, joviality by the children, the love of school. Those who were coming late before are now punctual, especially like my friend Ahmed.
Their sense of livelihood and empowerment of beneficiaries to better their lives and contribute their quota to the society was evident in some parts of the country.
Like the lockup, it has helped them, saved them the burden of carrying goods every day to a market. And at the close of the day, spending, of course, you know, with the fuel increase, it wouldn't be an easy matter. Spending money, hiring a vehicle to take those things back, it has saved them.
The intervention by EU have at least helped us in modernizing, putting the at least reducing the number of youth reservists at the street. A lot of time, the environment itself, this Mafoni per se, we have a lot of students or a lot of trainees that were not doing anything. Rather, there's no job to do. But with the intervention of the EU, the tools they have supplied to us, the renovation of the workshops, we were able to at least bring these communities, youth, train them, and if you can go by the side of the road now, you see welders, you will see carpenters, you will see plumbers All of them were trained because of the material supplied to us by the EU.
Lokacin da wayannan insurgency suka zo suka kokone suka babata wurin har masu sun zauna a ciki suna to da aka samu sauki sai European Union da suka zo sun zo sun yi gyare-gyare sun gyara sosai mai kyau wallahi da mara lafiya sun samu gado sun samu wajen kwanciya sun samu da windows nan duk gaba daya iska in ayi ma ba za su iya su zauna a abu nan ba so sun ji daɗin gaskiya.
Lokacin da aka rushe gidan ya rushe gaba daya ma gidan mutane muka koma muka ciki ba nan din ba komai a ciki muna gidan mutane ne kuma alhamdulillah an zo an mana taimako an gina gidan to aka gina gidan kuma yanzu gashi iyaye suna ciki suna rayuwarsu ciki kuma mun gode Allah mun gode muku kuma ga ruwa kuma har yau mun bude mana ruwa muna samun ruwa akai-akai.
Ka fata riga zayin da jim da su biyan ji saccin fatan mashin da nan mena kuma an da kara jim palle nan mena kuma su roman ji saccin jim
da ya fato are oktoro bro nan mena re tompallin nan mena tompallin are nan mena ro isa nero garrare cero ande kungiya EU yaro taida ne askriyena karo kujinde taida ne fulenera.
Now we have more communities that have returned, and these communities are desirous of this type of interventions that happened in the communities that were able to be reached at that time. Some of these communities were called hard to reach location, and sometimes they were desolate. Nobody was living in them. But today they are back, and they need this support in these areas I have mentioned, the areas of health, wash, and all the areas that EU has intervened.
As dusk falls upon these landscapes, it leaves behind a trail of hope and transformation due to the dedication of the European Union. Through their projects related to health services, water resources management, solar energy adoption, education enhancement programs, community resilience building initiatives, infrastructure development endeavors, and livelihood support schemes, countless lives have been positively impacted. Communities have been uplifted and sustainable change has been ignited.
All of these inputs, outcomes, and impacts are strategically part of the aspirations in our National Development Plan, and the Federal Ministry of Budget and Economic Planning appreciates the support of the EU towards the achievement of the targets for sustainable growth and development over the years.
I think moving forward, this program has been able to really help us see and to grasp the massive amount of and the variety of different projects that have been funded all over Nigeria. It also helped us learn some very valuable lessons, also for projects that have worked very well, but also that work less so. And I think, as I said, it will be a reminder of the interesting journey we have had over the last 20 years and also inspire us in the common dream and working together to make Nigeria better and stronger for all.
However, this is not where their journey ends. It serves as a testament to what can be achieved through action fueled by compassion and determination when striving for a better tomorrow. As the European Union continues to sow the seeds of positive change, the sun rises on a brighter, more promising future than ever before.